Hi guys, so I wanted to go over the Corex briefly with you. If you have a case coming up here, this is it's a coring device for getting cancellous bone. I prefer the PSIS, is where you'll see the majority of the cases done with this. The PSIS has the least amount of neurovasculature, unlike the anterior iliac crest, where the neurovascular bundle is pretty pronounced. You have some periosteal nerve innervation, both anterior and posterior, but that's unavoidable. Tip here, and the tip here will actually pop off with this mechanism that slides, and you'll see how that works. There's a turning mechanism here that actually pinches the tip without the top on, that'll keep the bone within the reservoir, and of course the plunger itself. Understandably, you're not going to have the plunger in quite yet. Okay, when you take it out of the package, it's going to be just like this. Okay, so you're going to have the tip here, and this is a 9mm. So this is the bigger of the two, and then there's a 7mm. You have the black notch here, which whatever it aligns with is what is going to be happening at the distal end of this thing. So if it's green, it's open, so it's ready to accept the bone. If it's turned and it's to red, then what will happen is it is closed. Think of the end of like a sphincter. It'll close so there can't be any bone that can escape. Okay, so when you're collecting, you obviously want it open. I prefer just keeping it closed because it's together and it's tight. So what you would do is once the surgeon makes their incision and they expose the PSIS where they want to go in, they'll dock it. See, as it has a sharp tip. They'll dock it. They'll stop. They'll do a fluoro. Once they're happy, they'll go ahead and do a back and forth. Just, you don't have to work real hard at it. Just kind of break through the cortices. There's usually 2 levels, of course. Once you break through the cortices, you're going to go ahead and stop there. And what you'll do is you're going to go ahead and push this forward, and the end will actually just come. Now you don't have to hold this. You can just hold it down. But to give you an idea, it just comes and pops right off. Okay, just because this piece will actually have it'll push this small connector piece that attaches to a small slit in here. So when you push it forward, it comes right off. Just make sure you have it pointing down, because if you're going up and you do it really fast, the dang thing will fly off. So just kind of bring it down and push down. Okay, open position. Okay, you're ready to start collecting. Same hole. Okay. You're going to go ahead and hold it with hold both the upper and lower housing of this, and you're just going to go ahead and do your back and forth motion, bring it all the way down to the level you want to go to. Typically, there's already points on here, 3, 4, 5, 6, 7 centimeters. Typically, you'll go down to about 5 centimeters, whatever the surgeon really wants. And when they're at their depth, before they pull out, they'll close it. Okay, so now it's in a closed position. And then they'll go ahead and pull it out. Nice pull back and twist at the same time. And then they'll open it back up, which opens it up to allow you to take the plunger and be able to do this. And what you'll see is it will gently, actually, it will not gently, but I mean it is gently, but depending on how you want to do it. But it'll actually push out the cord piece that you want. And this would be the cancellous bone. And if they need to go in again, all they have to do is put it back in, is make sure it's in open position, and go and maybe move in a different trajectory. Okay. Okay, they're done. Close it. Open it up. Open it back up. And you'll go ahead and plunge it, and you'll get another core. So you can do this as many times as you need. Okay. Okay. So that's the take home of using the Corex bone harvesting system.